Welcome. I'm Doug Sesserman, and it's hashtag Webinar Wednesday. We've got a great program today. Thank you all for joining us. We're going to be talking about advancing women's health in underserved communities with a terrific panel. And this is really the conclusion and celebration of Women's History Month. So we're just excited that you all joined us today. But before getting into our program, we just want to highlight a great event we have coming up on April the 25th, a virtual event that is free to attend called Celebrating the Remarkable, where we will be honoring Tony Young, our past board president and an extraordinary human being and philanthropist, as well as Philip Gompertz, the professional who recently retired from our organization, who stewarded the largest gift in Israel's history, the incredible $400 million Marcus Endowment. And finally, Dr. Ruth K. Westheimer will be receiving her first and only honorary doctorate from an Israeli university. It will be conferred by BGU President Daniel Shamovitz, as well as Rector Chaim Hames. So you don't want to miss this event on April 25th. We like to say that if you love Israel and like sex, or both, you don't want to miss this event. So April 25th, free to attend. Please join us. So today we have a great panel featuring Dr. Lynn Cottell, Dr. Rachel Pope, and Aaron Phillip. And we're going to have a discussion about advancing women's health and the incredible work of the Medical School for International Health. Ben-Gurion University has two medical schools, one that teaches in Hebrew for Israeli students and one that teaches in English. The faculty are shared. And our medical school we're going to highlight today is the Medical School for International Health. And Dr. Lynn Cottell has joined us. Welcome, Lynn. Lynn is the director of the North American office of BGU's Medical School for International Health. Dr. Cottell is a pediatric pulmonologist on the faculty at Columbia University and has contributed to the development of clinical guidelines for cystic fibrosis. She served as the director of Columbia's Cystic Fibrosis Center for 20 years and has been on multiple national committees, including the Cystic Fibrosis Center's Directors Committee. Dr. Cottell is an associate director of the Data Safety Monitoring Board for the Cystic Fibrosis Foundation. She earned her undergraduate degree in biology from Hampshire College, and she received her medical degree from Sackler School of Medicine at Tel Aviv University. Welcome, Lynn.
Thanks, Doug. It's good to see you. I miss seeing everybody in person. So I just wanted to talk.
I miss you too, and I'm in our actual office.
You're in the office. I know. And you have Ben-Gurion's got his mask on, which is a great reminder for everybody to mask up and get vaccinated, please.
That's right. That's right. So Lynn, we were going to start this program. You were going to tell us about the Medical School for International Health.
Right. So just a few minutes about MSIH. So MSIH is a 4-year American-style medical school that incorporates global health into the MD curriculum. This includes a year-long introduction to global health course, global health modules, and cultural competency training. The global health modules are really amazing, and they are short interactive courses on subjects such as disaster relief, migration and health, medicine and society, health inequities, and so forth. Unlike many medical schools in the States, clinical exposure begins in year 1, and students are able to work with the diverse population of Israel. Our 4th-year students complete a 2-month capstone global health clerkship at affiliate programs in India, Nepal, the Philippines, Sri Lanka, Peru, Mexico, Ethiopia, Israel, and Ghana. As healthcare providers, we believe strongly that working towards equity in health and increasing access to healthcare is as much our responsibility as the treatment of disease. At MSIH, our students learn not only to be a doctor, but they also learn to be a skilled physician with a comprehensive view of health around the world. MSIH students learn the science behind medicine, but they also learn about the social and economic determinants of health. And I think that when we go into our panel discussion, you'll really see how strong that teaching is. They gain experience working with diverse communities throughout the world. Graduates of our program are skilled physicians who make a real impact as medical practitioners attuned to social justice. Our MSIH graduates are well prepared to complete residencies in North America as well as in Israel. During their 4th year, students complete electives and clerkships at highly selective medical centers in the United States and Canada, including Columbia University, Mount Sinai University, Northwell Center, Mayo Clinic, and the University of Tennessee. Our residency match rates are parallel to top medical programs in the United States. And this year, we're delighted to say that we had a 96% match rate. And Aaron, although he's still Aaron Phillip, in a few weeks will become Dr. Aaron Phillip. And he recently matched in an OB program, and he'll tell us a little bit about that. As you will see during this webinar, at MSIH, students gain the training necessary to practice medicine while meeting the challenges of providing healthcare in resource-poor settings throughout the world and how to make a real impact. Our graduates are highly trained physicians who understand how to work in the intersection of global health and community and preventive medicine. MSIH alumni practice medicine all over the world. Over 50% of our alumni are involved in global health work after residency. They practice in the US, Canada, Israel, and across the globe in countries such as Jordan, Uganda, and Malawi. They are professors and they are practitioners. They are involved in healthcare public policy and research. They work in hospitals, clinics, private practices, as well as within Doctors Without Borders, the CDC, and the NIH. So I look forward to hearing from both Rachel and Aaron, and I think everybody will really be just excited to hear what our students and our graduates do. Thank you, Doug.
That was fantastic, Lynn. And before we bring in Rachel and Aaron, I just wanted to ask you a quick question. So sometimes you refer to our doctors from MSIH as the Tikkun alum doctors. Can you just elaborate on that?
Absolutely. So I think that we all think about, and for those of us who sort of grew up within the Jewish community and with Jewish education, that one of the strongest facets of our Jewish culture was to give back to the world. And I think that when we talk about Israel being a light unto the nations, what I am always struck by in our graduates and our students is that we educate them, we ship them out all over the world, and they're giving back everywhere they are. They really embody the best of Israel, the best of sort of what we view as the values and that are really true to what Ben-Gurion wanted BGU to be.
Thank you very much. And thank you to the more than 100 participants who registered for this event. And most of you have shown up today, so thank you so much. For those who are joining us for the first time, we will be having a conversation, but there will be time at the end of the program. This webinar is called for 45 minutes to ask questions. So to ask a question, you just click on the Q&A function. I'll be able to read the question and then send it to the appropriate panelist. So that's just great. And also behind the scenes, we have some amazing people who pull all this together. A quick thank you to Melody Mokhtarian, our Director of Events and Experiences, to Liz Kirshner and Kara Bortman, who's got us live on Facebook with our audience growing geometrically as we speak. So our next speaker, Dr. Rachel Pope, literally just left surgery to join us. Thank you.
No problem.
You don't have to tell us what you were just
life.
doing,
Right.
but we appreciate your commitment.
Gynecological surgery.
Yeah, we appreciate your commitment to your alma mater, so it means a lot. Okay, so Dr. Rachel Pope earned her medical degree from Ben-Gurion University's Medical School for International Health in 2011. She completed her residency in obstetrics and gynecology at the University Hospitals in Cleveland, where she now works, and her fellowship in global women's health at Baylor College of Medicine in Waco, Texas, if I've got that right. I've been
Houston,
following.
Texas. Sorry.
Yeah. And Baylor,
the other Baylor at Houston. Yeah.
Got it. Not the Baylor with the great basketball team.
Right. Unfortunately.
Okay. Houston. I mean, I don't know. I'm not going to ask you who you're rooting for between Houston. But let's get back to being a doctor. Following her fellowship, she served as the medical director and head surgeon at Freedom from Fistula's Obstetric Hospital in Lilongwe, Malawi. While she was there, she was the fellowship director for Baylor's Global Women's Health Program. Her husband is also a doctor. He's a family and preventative medicine physician, and they have 2 young daughters. Now we're getting to the important stuff. They currently reside in Cleveland, where Dr. Pope is the division chief of Female Sexual Health and Urology Institute at University Hospital's Cleveland Medical Center. She also received her undergraduate degree in anthropology from Case Western Reserve in Cleveland. So you're a Clevelander.
Not
Dr.
by
Pope.
choice, but by school. Yeah, I was born in Pittsburgh, Pennsylvania, and which is a big rival with Cleveland. So it's kind of funny. I've ended up spending so much of my life here.
Yeah, well, I love Pittsburgh. My wife is from Mount Lebanon.
Oh, okay.
And her father went to Case Western for his doctorate. So
Right.
a lot of rivalry. Right now, that Cleveland football team's doing a little better. But let's talk about you. How is it possible that Rachel Pope, Dr. Rachel Pope, went to medical school in Israel? You're not even Jewish,
Yeah.
from what I understand.
That's right. I grew up in a Jewish neighborhood, and with the name Rachel, everyone thought I was Jewish, but I actually was raised by 2 Christian parents, and I tried to just blend in wherever I was. But I was studying anthropology and was pre-med in college, and I honestly felt disillusioned at that point. I knew I wanted to do medical school and wanted to practice medicine, but I kept finding myself frustrated with not finding a humanistic view of the way to learn about medicine and learn how to practice medicine. I looked around at my peer pre-med classmates and felt like these are just, they just have a different mindset. They have a different reason for going into medicine. I didn't see this human touch that I was looking for. I honestly almost thought that maybe I should go into nursing or midwifery. At one point, I thought maybe I should be an anthropologist. And I was looking around for anthropology grad programs that focused on culture and focused on the human experience. And I came upon a link for MSIH, and the tagline was humanizing medicine on a global scale. And that was so impactful to me. It resonated with me that, okay, these are my people. I hadn't heard of the program before, so I spoke to a few mentors of mine who practice and teach global health. And they said, actually, we've had some physicians come from that program and practice at our hospital. They're extremely well trained. They have to learn how to get back into the US medical system because things are different with the Israeli medical system and US system. But after that little bit of adaptation, they do a really good job and they're amazing physicians. So that kind of sealed it for me. I was actually doing my master's in public health and was doing research in Tanzania when I was invited for an interview. So instead of interviewing with Lynn in New York, I interviewed in Israel in Beersheba with Dr. Glick, Professor Glick, and a few other people who were there, met the students, saw the campus, and just, super excited about it and couldn't wait to start.
Was that your first trip to Israel when you actually went?
It was, but also growing up in this Jewish neighborhood, I had several friends who were actually in Israel, either volunteering or just visiting family who were there at the same time. So while I was doing my interview, I got to see some other friends, which I think also just made me feel so much more comfortable about moving to another country, studying in another country. It didn't feel foreign to me.
Wow, that's amazing. So I want to get to Aaron soon, but just what does Israel mean to you?
For me, I saw Israel as a melting pot, a more fresh melting pot than the US. People describe the US as a melting pot. But I saw this hospital with incredible technology and current guidelines, current, very up-to-date capabilities, but taking care of patients from all over the world. I saw women from Ethiopia carrying their children on their backs, very traditional to Ethiopia, but in Beersheba. I saw immigrants from Russia, from Iraq, from all over the world, and just couldn't believe how all of these people were coming together in one place and receiving such high quality care. And I felt like
You're speaking about Soroka Hospital, which is adjacent
Correct.
to the campus. Yeah.
Yes, correct. And so seeing that in practice and seeing that, in person made me realize, okay, this is where I want to be. I'm with people who take culture into account of their care for people, really have a holistic view of what wellness is and how to help people get back to their normal lives, and just are more embracing of what that is. And so that's what Israel is to me, kind of embracing this multicultural possibilities within one location.
Thank you. And then let me ask you one question about something you started with. First, it was great to hear that marketing and taglines can actually work.
Yes, amazingly.
But I want to, what you were attracted to is actually a point of differentiation for our medical schools, which is the humanistic approach. Sometimes we say that we teach our doctors to teach our students to treat the patient and not just the problem.
Right.
So tell me a little bit about the curriculum for you at MSIH and this humanistic approach, and how does our actual curriculum deliver on what we say?
Oh, 100%. I mean, the culture was integrated and I'd say woven into our classes from the very beginning. Language and the issues of working with an interpreter and understanding how language influences medical care is integrated from the very first day. That is just so integral to the education, and it's applicable everywhere. I've come back to Cleveland to work, but I was living in Malawi for the last 4 years before coming here. And those skills that were part of my medical education I was using them every single day. And I should mention my husband, as a family physician, also is an alumnus of MSIH. So we actually met there and have since worked abroad together. And I feel like he would probably say the same thing in terms of incorporating culture and that important humanistic touch, right? In every lecture, not just having a course about culture and humanism, but every single lecture included that as sort of the lens.
That's amazing. So you didn't just get your degree, you found your future life.
Yeah, I was pretty lucky that way. Yeah.
That's amazing. Before we get to Aaron, Lynn, could you just go off mute for a second? Could you comment on the humanistic approach and what differentiates from a curriculum standpoint?
Yeah, I think Rachel really expressed it super well, but what she said is really true. It's really incorporated into all 4 years. I always love to tell this story. There's one course that the students do in their 3rd year of school where they have professional actors who come in and act as patients, and the students interview these patients, and then the actors give them feedback. But in each of the scenarios, the clinical story is exactly the same, but the cultural background that the actor is playing is entirely different. So just very quickly, the one that I saw several years ago was a man with asthma being discharged from the hospital. And in one scenario, he was a Bedouin who wanted to go back and smoke hookah with his buddies. In another scenario, he was a migrant worker who didn't have insurance and didn't want to spend money on medicine. He wanted to send it back to his family. And then in the third scenario, he was like a hippie from Tel Aviv and had to about taking medicine with his guru. And so that really sort of shows you that the medical story can be exactly the same, but the cultural barriers are so different. And as a physician, you have to learn to read those and react to them.
Thank you. And thank you, Rachel. Please stay on. We're gonna introduce Aaron, and then we'll have some Q&A with everybody at the end.
Okay, great.
We're very proud of you.
Thank you.
Okay, Aaron Phillip, who is, bring back your video. Perfect, Aaron. You're looking good. We know it's very early morning where you are in Hawaii, but we don't feel bad for you. But thank you for joining us. Aaron Phillip is, as Lynn mentioned, a 4th year student who just matched for his residency. So mazal tov, as we say. And he received his undergraduate degree also in anthropology, which is interesting, from Tulane University. Aaron is from Houston. He grew up with a deep appreciation for his 2 older sisters, who played a major role in his passion to ensure that women feel secure, heard, and supported. I think when this webinar is over, can you like teach me a little bit about how to do that better? Through exposure to different surroundings in our country, the United States, but also his experience in the Peace Corps in Nepal from 2013 to 2015, and his current experience in Israel, Aaron aims to better understand the challenges that women face in their lives. As a prospective OBGYN, he hopes to continue to advocate for women to meet their healthcare needs. Welcome, Aaron.
Hi, thanks for having me.
We're so excited to have you. So first, tell us about your match
Yeah, so
and
I'll
your
be,
future. And then when you're done telling us about that, tell us how you ended up at Ben-Gurion University.
yeah, so I'll be spending the next 4 years of my OBGYN residency at Mountain View Hospital in Las Vegas, Nevada. And I'm really excited. One of the things that we talked about is that we really hope to support the health infrastructure of Nevada and try to buttress it in terms of women's health, which aligns very well with my passion for the field. So I'm really excited to be there. And yeah, the Southwest is a very nice place to be.
Wonderful. So let's talk about your motivation for becoming an OBGYN. And as I mentioned at the beginning of the program, this is our last program that we're dedicating in celebration of Women's History Month. So just tell us about why you're pursuing your field and what you've learned at BGO.
Yeah, so I think as someone who like grew up in a bicultural community, my parents are immigrants to America, and then also having the anthropology background, I've always kind of gleaned the interest in learning from other people's perspectives. As you mentioned, I have two older sisters, and so they've really formed and shaped a lot of my views on the world. And I think as time has gone on through childhood, through Peace Corps, through college, through MSIH, I've always like had a special attention on the perspectives of women as they're going through lives. And so, yeah, it just like started to kind of mesh really well in my first year and second year. I started to realize like OBGYN was the right field for me. And it felt reaffirmed in third year and fourth year as I've been going through the curriculum. MSIH was really great because after having like learned challenges that women face in Nepal, I got to yet again go to a different country and learn from several communities, including the very religious community in Israel, as well as the Bedouin community in Israel. And then also, just like you said, the hippies of Tel Aviv. So it's just really cool to be able to understand the different power dynamics and understand the different obstacles that women have to face as they're trying to access just a healthy life. And I hope as a physician, I can just be more aware and present for those, even when it's maybe not expressed, and really just try and support them and be a good physician.
Where did you first learn about the Medical School for International Health?
Yeah, so I was a Peace Corps volunteer from 2013 to 2015. The major earthquake happened in 2015. So I was in the process of creating a whole Peace Corps project at that time with a very large grant from USA. And then the earthquake hit. And so the earthquake hit and we were evacuated out of the country and brought back to America. And then we were returned back to Nepal to finish our service. And so when I returned to my service, I thought I was going to extend for another year to finish out my grant. But it just so happened that the entire community's mentality had shifted to earthquake preparedness. And so we stopped focusing on youth health activism. So what ended up happening coincidentally is that there was a Peace Corps magazine that had an ad for MSIH in there. And it basically described MSIH as a medical school gone Peace Corps. And so I just really like loved my time in the Peace Corps. And I thought that this would be a chance to yet again kind of live and breathe 24/7 in a new place and incorporate studies along that way. So yeah, that's how I ended up at MSIH.
That's amazing. So, Lynn, another example that your marketing efforts work. So Lenore Levine couldn't join us today, but she's listening, and I'm sure she's smiling. So, Aaron, tell us a little bit about your clerkship.
Yeah, so this year I've been doing electives around the States. That's actually why I'm in Hawaii. So you might be seeing the sun come up sooner or later. But I've been able to, thankfully, especially to a lot of our mentors, the alumni community, the OBGYN alumni community of MSIH, I've been able to experience women's healthcare in different pockets of the US. And that includes Central Washington, where the Yakima Nation members live, all the way to Northern Kentucky, where elderly women are facing challenges in their lives. And so it's been just really interesting, yet again, to learn different challenges that women face in these different areas, especially since I come from a suburbia of Texas. And have only been to like major cities. I've gotten the chance to see more rural areas of United States that I would never probably go to, but now I'm interested in actually going to.
Do you plan on practicing in the States, or might you go back and
so
overseas?
Prior to MSIH, my envision was always that I would work towards becoming some kind of like consultant for Ministry of Health and focus in on adolescent health activism. So a lot of my focus and interest in OBGYN are related to the adolescent population. And so that's something that I hope to do, but I do also see myself living in the States and working in the States, probably in an area that has lower health infrastructure or less health infrastructure. So yeah, I mean, I'll definitely see how residency transforms me, and then based on that, move forward to the next life chapter.
Very good. Do you have anything else to add about your experience before we bring Rachel back on?
I mean, the best thing I would say is, and Dr. Pope also mentioned this, but the classmates that I've had are probably the greatest part of MSIH, and just being surrounded by like-minded people who genuinely and sincerely care about people who are different than you is really lovely, and it's very inspirational.
Excellent. Thank you, Aaron. We're also very proud of you. Not only what you've done, but what you're going to do.
Thanks.
Okay, so Rachel, you're back. Thank you, Dr. Pope.
Yeah, no problem.
For those participants to ask a question, just click on the Q&A function and you can ask a question. This first question comes from Hayden Matthews. It's addressed to Rachel or Aaron. Do you plan to, and Aaron, you spoke about this a little bit, do you plan to use your training specifically in an underdeveloped setting? And if so, what does that look like to you?
Doug, before Rachel answers, can I sort of interject and build on that question? Because I think that what would be interesting is to have Rachel talk about her career trajectory, about how she ended up from medical school, living in Malawi for 4 years, and how that translates back to her work in the States right now.
Yeah, no, that's appreciated. Thank you. It's interesting. So when I was in college, I heard about this problem of obstetric fistula, where women who are in labor and need a cesarean section, but literally can't get one, end up with severe pelvic floor injuries. Most of the time they end up incontinent of urine, sometimes of feces, and it becomes a social stigmatization problem as well. They often spend several years before they get surgery to correct it. And so this was a huge social justice issue for me, something that really called to me as an issue for women worldwide. And that was what I focused my research on for public health when I was doing my master's in public health. So when I came to MSIH, one of the fantastic things was that I was not that far away from sub-Saharan Africa, where I had just done my research and where there's so many countries where women with fistulas live. So I used some of my school vacation time to go to Ethiopia. And that's where I saw my first set of fistula surgeries at the Hamlin Fistula Hospital, and met some of the people who would actually then become mentors to me even to this day. I then spent another vacation going back to Tanzania, where I had done my research and following up with the women that I had interviewed there when I did that project, and just continued to make more connections with fistula surgeons and people who are dedicating their lives to that area. So I knew I needed to do residency. I had to finish up my skills. So after I graduated from MSIH, I did my residency at a place where I knew I would get elective time to then learn fistula repair. In actuality, since I'd really just been an observer until that point. And I did this elective in Malawi, and spent 6 weeks there learning the basics of obstetric fistula care and surgical repair. And while I was there, that's when I ended up finding the fellowship opportunity to come back to Malawi through Baylor College of Medicine, where I spent 2 years as a fellow learning obstetric fistula repairs and then doing some general obstetrics and gynecology at the government hospital there. So then I stayed on, and that's how I ended up in Malawi for a total of 4 years. I stayed there to continue running the fellowship program and running the fistula hospital. So it was something that I was interested in for quite a while, but MSIH allowed me to develop that interest from an early stage. I mean, I know people who now are already fellowship trained in subspecialties and trying to learn how to do obstetric fistula repair, because it's something that we don't see in the US. But because of my proximity to sub-Saharan Africa, and because of the dedication of global health, and even, I could use my elective time if I wanted to during medical school to really learn how to get into this field, I was able to kind of springboard into that subspecialty from, such an early stage. And that helped shape not only my early career, but also what I'm doing now as I've come back to the US. I'm doing a lot of gynecological reconstruction, vaginal and vulvar reconstruction. I'm also sometimes seeing women with fistulas, but not necessarily from childbirth. Very rarely from childbirth, sometimes 3rd and 4th degree lacerations from childbirth though, and things that overlap where women need vaginal or vulvar reconstructive surgery because of the way it interferes with their sexual life or with their everyday quality of life. So it's really been tied together, but I was able to carve out those opportunities at MSIH, which I'm really grateful for.
That was an amazing answer. Thank you. Aaron, you want to take a shot?
It's so hard to follow Dr.
Oh, sorry. Well, I have a few years on you.
Yeah, so I think one of the things that is a really big passion for me is just education, specifically for the adolescent population. So I've worked in Nepal on helping younger women, challenge their cultural notions that they might have regarding menstruation, and understanding it better so that they feel more confident in themselves and not feel ashamed by it. And so those are elements that I also hope to take through with residency, and for places that are in the South as well, like things like sex education in schools are not well developed. And I think that that's an opportunity that I hope to take advantage of and try to help support as a new OBGYN. Yeah.
Excellent. So we're getting a lot of questions, so I want to get to some of them. So Stephen Hurst, who's a great supporter, good friend of the university, and a dedicated volunteer leader in the Bay Area. He's asking, I think this is really, Rachel, maybe more for you and also Lynn. Do you continue to interact with some of your classmates after graduation, and kind of what's the role that MSIH alumni play in mentoring, et cetera, current students?
I think Aaron spoke to it a little bit, that first you get to this school where you're with so many like-minded people. And I mean, those really become long-lasting friends. In my case, also a life partner. But I know that's not the typical. We can't quite advertise that, right?
There are a number of marriages.
Yeah, that's true. That's true. But honestly, I've been in very close contact with many of my classmates, especially during the pandemic. We've had some Zoom calls together. We kind of check in on one another. We really draw inspiration from one another. Dr. Jordan Lohr and Dr. Annetta Madsen are both OBGYNs that we reach out to each other all of the time because we understand one another, and we have very similar goals and mindsets when it comes to taking care of underserved women. And so I'm really grateful for those relationships. I'm also in touch with, Dr. Adam Rosenblum and his wife, Sarah Bonds, who are, she's an activist, a social justice activist, and a midwife. And so she and I collaborate all the time. She was a guest speaker in one of my public health courses that I'm teaching, and I've come to do some commentary for her around COVID-19 and pregnancy. And so there's a lot of interactions like that. And then, of course, there's a women's health or global women's health interest group at MSIH that I've done some lectures or talks to, so that to try to help them kind of develop and figure out their path and what they want to do and how to get there. So there's a lot of MSIH interaction, actually.
Lynn, did you want to add to that?
Yeah, definitely. I think that both Rachel and Aaron have really alluded to the fact that these classes are small. And I remember from my own experience going to medical school in Israel. I mean, even all these years later, some of my closest friends are my medical school colleagues, because you are living halfway across the world from home. And medical school is a very unique experience, and you get close to your medical school colleagues. But also we really do build on each other. And as a school, we really reinforce and try to keep our community together. So we have an alumni association. We periodically host when the classes want. Lately, we've been doing it by Zoom, sort of Zoom reunions. And our alumni have been our rock stars this year because of the pandemic. Our students have not really been able to do electives in the States the way they normally would, nor have they been able to do their traditional global health clerkships for 2 months. And it's our alumni that just came through just day after day with rotations for them. So there's not only is there interaction within a class, but we've really, I think, done a great job of fostering interaction amongst the classes. And we just started a scholarship drive amongst our alumni, and I am really just so proud of them and grateful and appreciative for how many of our alumni have really donated to our scholarship drive.
That's great. So Lynn, I think this is a question for you. It's coming from Richard Harwood. He's asking how many countries are represented in a typical medical school class in the international medical school?
That's a great question. Our goal, so I've been with MSIH from the beginning, and our goal was really that it would be an international class. There have been some limitations in that in order to have the preparation and to be eligible to go to medical school, you have to have an undergraduate degree and have completed all of the pre-medical school requirements. So the bulk of our students, are educated in North America, either in the US or Canada. And depending upon the year, about 30% of our students are non-US born. And that really varies year to year. So over the years, we've had 2 graduates from Papua New Guinea. Interestingly, one of them was a native of Papua New Guinea. One of them was actually, his parents were missionaries, but he had been raised there. We've had students from Japan. We've had students from some of the neighboring Arab countries. So in order to come to school in Israel, you also have to carry a passport from a country that has relationships with Israel. We've had Russian students, I'm blanking, but there's been, usually it's about 30%. We've had several African students over the last few years. And one of our rate limiting factors for having students from other countries is really their ability to finance education. So as Doug knows, I'm always talking about scholarship. It's like my theme in life, right, Doug? And so one of our rate limiting factors is being able to offer scholarship to students from other countries who otherwise wouldn't be able to afford the education.
Can you speak a little bit about the fellowship program?
The African Fellowship Program?
Yep.
Absolutely. So one of our drives in the last few years, and we've had several really wonderful people step up to the plate to help us, is to really develop a fund to support African students who want to come to MSIH, have the education to come, and to support them through their 4 years of education. As an example, one of our graduates from last year is from Ghana. She did her undergraduate education in the United States, graduated last year, and is now doing a pediatric residency at Mayo Clinic. So we really want to have more graduates like that. But the only way that we can really do it is by growing this, our African Scholarship Fund.
Thank you very much. Okay, so we're starting to be toward the end of our program. We might go a couple of minutes long. This webinar was called for 45 minutes, but you're also interesting and the questions keep building. Okay, so we have a question from an anonymous attendee that's asking if you could speak about some of the challenge you've experienced serving helping underserved communities in Israel, and could you specify which communities have what kind of struggles with women's issues?
I can speak to that. I mean, even though I was at MSIH quite a while ago, when I was there, there was a huge refugee crisis from Sudan and Eritrea. And so there was a huge influx of refugees that were coming through Israel and had a number of problems. We ended up forming, there's a lot of student activism around it, trying to help with health needs, both in the Israeli program and the American program. And one of the issues that we saw actually was that there were quite a few pregnant refugees who needed resources and needed help getting into the Israeli healthcare system. I'm not sure how many of those women were trying to immigrate or what was going to happen, but at that time they needed healthcare and they didn't speak the language. They didn't know where to go. There was quite a few obstacles. And so we formed a student group along with some community members to really work with these women to try to help them get into the system, learn how to navigate it, and just get their basic pregnancy care, their prenatal care, and make sure that they weren't alone when they were going in for labor. So that was one of the things that came up while I was in school.
We've also had experiences where some of our students, sort of like Aaron, had done Peace Corps and had learned languages that were specific to a region. And periodically, I remember there was a young man in the hospital at one point who had a malignancy. I think he had a lymphoma. And one of our students knew his language and basically became his translator and would go with him to all of his doctor's appointments.
Excellent. Aaron, maybe you could speak to a little bit the unique environment at Soroka, where I think 50% of the babies being born are Bedouin.
Yeah,
so
what it's like to be, teaching there and then practicing.
Yeah, so one of the really big memorable moments of my OBGYN clerkship was understanding the paternalistic aspect of the culture that surrounds childbirth. And so common or really simple things such as can I have an epidural or not is answered by the husband oftentimes. And so that was a common situation that we would have to come across as students, and just kind of morally accept that this is the way that this is their culture works. And I think that that's as someone who wants to challenge cultural norms and be more of an advocate for women in their healthcare decisions, I think that's a really memorable experience to constantly reflect on and try and change in the future.
And likewise, and Aaron, I don't know if you had this lecture, but obviously within the ultra-Orthodox Jewish community, there are a lot of norms that are somewhat difficult for Westerners to really understand. And there's a woman who teaches women's health to Haredi women in Jerusalem. And she, most of the time, I don't know, Aaron, if you had any experience with her, but she comes down and gives a few lectures to the students about working within the Haredi population.
Rachel, did you have something to add?
No, that was it. I mean, whether it was with the refugees or just with the patients who are coming through Soroka, I think it was always cultural navigations, but that was kind of expected. And part of it all. And maybe that helped me now in the US to have this expectation that there's going to be cultural differences. Maybe that made it easier, I would say.
Very good. Okay, we're going to wrap things up. We have a few questions still, and we'll try to get these answered separately outside of this webinar. But we really appreciate all of you panelists. If you could, we'll just finish with some closing remarks from each of you on whatever you'd like. So we'll start with you, Lynn.
I want to thank everybody for coming. And as I was listening to this, I always feel that these webinars, and when I see our students and our alumni speak, I feel like it reinvigorates me and gets me so excited again about the program, especially this year when I haven't physically been there and I haven't really seen a lot of people. So I really want to, Rachel, thank you. Aaron, thank you for like sort of giving spark to my day.
Great. I can go next. Yeah, no, thank you. Thanks. No, likewise. I think it's always reinvigorating, and I really had gained so much out of MSIH. And just to touch upon that one question, I did know I wanted to be an OBGYN when I went there, and it's like it was just very reaffirming for me, and having all the opportunities was extremely reaffirming. So I'll always be grateful to the program. And I think if you're a person who thinks outside of the box, and it's a great school for you, and it's just a remarkable program, and I only wish more people knew about it.
Well, more people are going to know after today's webinar and all the sharing on social media.
Right.
So thank you, Dr. Pope. And Aaron, would you like to have the closing comment?
Again, it's really hard to go after Dr. Pope, but I think I just want to say that, yeah, like MSIH has continued to like help me think more beyond myself and think more of others, especially from whatever shoes they are coming from. And I think that that's really important also to answer the question as a man going into OBGYN. And I think it has helped me to be more sensitive and be more aware for others that are different than me. Yeah.
Well, I want to especially thank our panelists. You're the first webinar we've done where in your closing remarks, you helped get some of the final questions answered. So congratulations. And Lynn, for all of your work and leadership of MSIH, it's truly one of the signature programs at Ben-Gurion University, and in many ways of the Jewish world. So thank you for everything that you do. For those of you who enjoyed this, as I mentioned at the top of the program, please join us on April the 25th for our Celebrating the Remarkable free virtual event, honoring Tony Young, Philip Gompertz, and the incredible Dr. Ruth K. Westheimer as she receives her first and only honorary doctorate from Israel, Ben-Gurion University of the Negev. David Ben-Gurion, the founder and first prime minister of Israel and the namesake of our university, once said that we must not ignore human ideals promulgated by our prophets, justice and loving kindness. From early childhood, we must implant in the heart of our children the aspiration toward a better society. And I'm not sure we have three better panelists that represent this than Dr. Lynn Cottell, Dr. Rachel Pope, and soon to be Dr. Aaron Phillip. So thank you all for joining us today as a participant and as a panelist. Be safe and stay healthy. Thank you.